The pills you take to feel better might be silently damaging your kidneys. Medications you thought were safe can sometimes do more harm than good. Are you unknowingly putting your kidney health at risk? Medications are supposed to help us feel better. But what if some of the pills you take every day could be harming one of your body's most vital organs? Your kidneys. From antibiotics to over-the-counter painkillers, some medications come with hidden risks that many people don't know about. As we age, our kidneys naturally become less efficient, making it easier for these drugs to cause harm. That's why it's so crucial to know what you're putting into your body. In this video, we'll uncover 5 common medications that can damage your kidneys. Whether you have pre-existing kidney issues or you just want to stay informed, understanding these risks can help you make safer health choices. And don't worry, I'll also share tips on how to manage these drugs while protecting your kidneys. 5. Antibiotics, treating infections but hurting kidneys. Antibiotics are a go-to solution for bacterial infections. They've saved countless lives and continue to be a critical tool in modern medicine. But here's the catch. Certain antibiotics can also harm your kidneys. From treating a simple sore throat to battling a skin infection, antibiotics like Cipro, Augmentin, and amoxicillin are commonly prescribed. However, some of them, such as polymyxins, aminoglycosides, and vancomycin, pose higher risks to kidney health. Here's why. Your kidneys are responsible for filtering these drugs out of your system. If an antibiotic is especially strong or taken in high doses, it can overwhelm the kidneys, causing inflammation and damaging the cells that filter blood. Imagine your kidneys like tiny sieves that work tirelessly to remove waste. When overwhelmed by certain antibiotics, they can get clogged, injured, or overworked, leading to what's known as nephrotoxicity. In some cases, kidney damage from antibiotics can be dose-dependent, which means the higher the dosage, the greater the harm. For others, it can be idiosyncratic, meaning that even small doses might cause issues, depending on how your body reacts. Here's a key fact. The CDC has found that nearly 1/3 of antibiotics prescribed in the US aren't even necessary, and inappropriate use of these medications can lead to side effects like diarrhea, liver issues, and yes, kidney problems. Before you ask for or accept a prescription, make sure to talk to your doctor and ask, is this really necessary? And if antibiotics are truly required, take them as prescribed. Follow all dosage instructions carefully and never share or save them for future use. Remember, antibiotics don't work on viral infections like the common cold or flu, so taking them unnecessarily could put your kidney health at risk without any benefit. Protect your kidneys by using antibiotics only when they're truly needed. The NSAIDs, pain relief that can harm your kidneys. We all reach for pain relief when headaches, sprains, or arthritis get in the way, and that's why NSAIDs, non-steroidal anti-inflammatory drugs, are so commonly used. Medications like ibuprofen, aspirin, Motrin, and naproxen are household names and are often used to treat everything from minor aches to serious pain. But what many don't realize is that while these medications provide quick relief, they could also be damaging your kidneys. Here's how it works. NSAIDs block an enzyme called COX, cyclooxygenase, which is responsible for producing substances that cause pain and inflammation. But this same enzyme also helps regulate blood flow to your kidneys and supports their ability to balance water and sodium. So when NSAIDs block COX, they not only reduce pain, but also reduce blood flow to your kidneys. This can lead to acute kidney injury, AKI, especially if these drugs are taken in high doses or for prolonged periods. Blocking COX can have 2 key effects on your kidneys. 1. Reduced blood flow. NSAIDs can narrow blood vessels in the kidneys, reducing the amount of blood that reaches them. This can lead to fluid retention, high blood pressure, and even acute tubular necrosis, a condition where the small tubes in the kidneys die off due to lack of oxygen. 2. Inflammation of kidney tubules. Although NSAIDs are meant to be anti-inflammatory, Using them over long periods can sometimes trigger inflammation in the kidney's filtering tubules. This inflammation is rare, but can lead to kidney issues that can worsen over time. A study in the Journal of the American Society of Nephrology revealed that NSAID use increases the risk of AKI by about 26%, especially in the first 30 days of taking the drug. And for those already dealing with chronic pain, a separate study showed that kidney function decreased in most patients taking NSAIDs for 12 months, but improved when they switched to another pain reliever. So how can you safely use NSAIDs? If you have kidney issues or are at risk, consult your doctor before taking these medications, even the over-the-counter ones. And if you're using NSAIDs for an extended period, keep your kidney health in check by staying well hydrated, monitoring your blood pressure, and asking your healthcare provider about alternatives when possible. Remember, while NSAIDs can be great for quick pain relief, regular use without guidance can put unnecessary strain on your kidneys. 3. Diuretics, the double-edged sword for kidney health. Diuretics, also known as water pills, are often prescribed to treat conditions like high blood pressure, heart failure, and fluid retention. They work by increasing the amount of urine your body produces, helping to flush out excess salt and water. Commonly prescribed diuretics include hydrochlorothiazide, HCTZ, furosemide, Lasix, bumetanide, Bumex, and spironolactone, aldactone. And while they're usually beneficial for your kidneys, these medications come with their own set of risks. How can something that's meant to help the kidneys cause harm? Diuretics affect your body's electrolyte balance and urine composition, and too much of these medications can lead to dehydration. When your body is dehydrated, your kidneys struggle to function effectively, leading to increased risk of kidney damage. For example, someone using high doses of diuretics or taking them for an extended period may notice they're urinating more frequently and feeling thirsty. Over time, this dehydration can put a strain on the kidneys, reducing their ability to filter waste properly. A study looking at over 1,331 patients using diuretics found that more than 27% of acute kidney injury cases were directly caused by these medications. And for people already dealing with kidney issues, dehydration from diuretics can worsen existing conditions. But it's not all bad. Diuretics are often prescribed to protect your kidneys by lowering high blood pressure, which can be a major risk factor for kidney disease. The key is in proper use and monitoring. If you're prescribed a diuretic, here are a few tips to manage its effects on your kidneys. Stay hydrated. Make sure you're drinking enough fluids to balance the water loss caused by the medication. Monitor electrolytes. Diuretics can cause imbalances in electrolytes like sodium and potassium, so regular blood tests can help keep levels in check. Check kidney function regularly. Keeping tabs on your kidney function with lab tests ensures that any issues can be caught early on. Nowadays, there are even home test kits available for more convenient monitoring. While diuretics can be helpful for managing fluid buildup and blood pressure, always consult your healthcare provider to use them safely and protect your kidney health. 2. Proton pump inhibitors, PPIs. Soothing your stomach but stressing your kidneys. When dealing with acid reflux, heartburn, or GERD, many people turn to proton pump inhibitors, PPIs. Medications like omeprazole, pantoprazole, and lansoprazole are widely used to reduce stomach acid and provide relief from digestive discomfort. While these drugs are effective at treating acid-related issues, they come with hidden risks, particularly for your kidneys. PPIs work by targeting the stomach enzyme hydrogen potassium ATPase, or proton pump, which plays a role in producing stomach acid. While reducing acid is great for preventing heartburn, long-term PPI use can lead to kidney issues like acute interstitial nephritis, AIN, a condition marked by inflammation between the kidney's tubules. This inflammation may go unnoticed at first, but it can lead to a gradual decline in kidney function. Research has shown that extended use of PPIs is associated with a higher risk of acute kidney injury, AKI, and chronic kidney disease, CKD. For instance, a study published in the Journal of Pharmacotherapy analyzed over 93,735 individuals and found that those using PPIs had a 4.35 times greater risk of developing AKI and a 1.2 times higher risk of CKD compared to non-users. Another side effect of long-term PPI use is hypomagnesemia, or low magnesium levels in the blood. Since magnesium plays an important role in kidney function and electrolyte balance, low magnesium levels can disrupt your kidney's ability to filter waste and maintain healthy fluid levels. This imbalance can lead to other serious health issues, such as muscle spasms, seizures, and irregular heartbeats. So, how can you protect your kidneys while still managing acid reflux? Here are some tips. Short-term use. Try to take PPIs for the shortest duration possible to manage your symptoms effectively. Monitor kidney function. If you're on PPIs for an extended period, ask your doctor to check your kidney health regularly, along with your magnesium levels. Explore alternatives. If possible, consider other ways to manage acid reflux, such as dietary changes, lifestyle modifications, or alternative medications with fewer kidney risks. Remember, PPIs are effective at relieving acid-related discomfort, but using them for the long term can lead to kidney complications. Always work with your healthcare provider to determine the best and safest way to treat your acid-related symptoms while protecting your kidney health. 1. ACE inhibitors. Blood pressure. Helpers with a kidney catch. ACE inhibitors, short for angiotensin-converting enzyme inhibitors, are widely used to manage high blood pressure, heart conditions, and kidney issues. Medications like lisinopril, enalapril, and ramipril work by relaxing blood vessels and lowering blood pressure, ultimately reducing the stress on your heart and kidneys. But while ACE inhibitors offer significant benefits, they can also pose risks to kidney health if not used properly. Here's how they work. ACE inhibitors block an enzyme that produces angiotensin II, a hormone that narrows blood vessels and raises blood pressure. By blocking this hormone, ACE inhibitors help blood vessels stay relaxed and open, which improves blood flow to the kidneys. For people with chronic kidney disease, CKD, this can reduce the amount of protein in the urine, a key marker of kidney health, and offer long-term protection. However, ACE inhibitors can also have some unintended effects on your kidneys. Since these medications change how blood flows through your kidneys, they can lower the glomerular filtration rate, GFR, which is a measure of how well your kidneys are filtering waste. For most patients, this drop in GFR is a sign that the kidneys are relaxing and reducing pressure, not necessarily failing. But in some cases, particularly for those with heart failure, severe dehydration, or artery blockages, ACE inhibitors may cause a larger decrease in kidney function, leading to acute kidney injury, AKI. For example, combining ACE inhibitors with other medications like NSAIDs or diuretics can increase the risk of AKI, and not drinking enough water while taking these medications can also elevate your risk. What should you do if you're on an ACE inhibitor? Regular monitoring. It's crucial to have regular blood tests to check kidney function, including GFR, and monitor for any changes that might indicate an issue. Consult your doctor. If you notice a significant drop in GFR, reach out to your healthcare provider. They may adjust the dosage, add supportive medications, or explore other options to protect your kidneys. Stay hydrated. Keeping your fluid levels balanced is key to supporting your kidneys when on ACE inhibitors. For most people, the benefits of ACE inhibitors, like reducing high blood pressure and protecting the heart, far outweigh the risks. But it's important to be aware of potential kidney-related side effects and manage them carefully under the guidance of your doctor. Conclusion. Protecting your kidneys while managing medications. Medications can do wonders for our health, but they come with their own risks, especially for your kidneys. From antibiotics and NSAIDs to diuretics, PPIs, and ACE inhibitors, the drugs we commonly use to treat various conditions can take a toll on kidney function if not used correctly. This is why understanding these potential risks is crucial to making safer choices for your health. If you're taking any of these medications, don't panic. Just be proactive. Talk to your healthcare provider about any concerns and ask how you can protect your kidneys. It might involve monitoring your kidney function regularly, adjusting dosages, or finding safer alternatives that still effectively treat your condition. Staying hydrated, managing your blood pressure, and following the prescribed dosages can all play a role in supporting your kidneys. Remember, your kidneys work hard to keep you healthy. Give them the care they deserve by being informed about the medications you take. Have you ever experienced any side effects from medications? Share your story in the comments below. And if you found this video helpful, give it a thumbs up and subscribe for more insights on how to protect your kidney health.